But first this hour, local public health officials and some state lawmakers are urging Governor Gavin Newsom and the state legislature to provide money to boost workforces in public health departments across California. Despite all of the work these departments have done during the past year, during the pandemic, Governor Newsom rejected their request in his proposed state budget. 17's Ashley Zavala reports tonight from Sacramento.
Some county health executives were early critics of Governor Newsom's proposed state budget. In response, the governor had said that he hoped once they reviewed it in full and the dust would settle, that they might change their tune. Well, the dust has settled and they haven't changed their tune. It's only gotten louder.
The biggest lesson of COVID-19 is that waiting until a crisis to invest in public health costs lives.
Local public health leaders, frontline workers, and lawmakers pleading to state leaders to provide new money to public health departments across California.
We have to reinvest. We have to rebuild.
Public health departments have been a primary focal point amid this pandemic and at the helm of California's response to COVID-19. The group Wednesday asking for $200 million in the state budget to help build up under-resourced and understaffed departments.
And even before COVID, our infectious disease response has always been short-staffed and dealing with high burnout. Basically, we have an endless cycle.
Others noting examples of departments having doctors fax COVID-19 test results because of dated technology. Others say some public health offices are only able to investigate a small fraction of diseases reported in their county. Assembly Budget Chair Phil Ting says the legislature is proposing direct funding to public health officials.
It's very, very clear that public health infrastructure wasn't up to snuff for a pandemic.
Governor Newsom left out the funding boost from his revised $268 billion budget. He says his administration would provide for public health by proposing a significant expansion to the state's health insurance program, along with more money for public hospitals and mental health.
There's a lot to celebrate.
This is not the same thing.
State Senator and Dr. Richard Pan.
This is a core government function of public safety. And I think people forget about that.
Newsom's administration is eyeing new future funds for local public health, but not until next year. The administration for now is proposing a $3 million study to nail down needs and lessons learned from the pandemic. Reporting in Sacramento, Ashley Zavala, 17 News.